All right, well, welcome to this online symposium that's a joint uh, event by the Center for Values in Medicine, Science, and Technology at the University of Texas at Dallas and the Consortium for Socially Relevant Philosophy of in Science and Engineering, or SRPoiSE. We have four talks for you today, as well as a post-lunch networking event. If you don't have at hand the schedule, it can be found at the Center for Values website, and I'm pasting that into the chat right now, the link. So if you want to consult the program. There is one change that we had to make very last minute that hasn't been pushed to the website. Unfortunately, Sindhuja Salam is not going to be able to join us today. And so instead, you'll have a talk by yours truly on expert authority and autonomy. Our first presenter will be Morgan Thompson, who is at the University of Bielefeld in Germany. Morgan, take it away.
Great, thank you. Let me just share my screen really quickly. Great, so I'm going to be talking today about a kind of new project that I'm starting. So I'm interested in all kind of feedback that you have about how I can improve and what directions might be interesting. And so I'm looking at kind of just exploring the ways that values play a role in the choice of different measurements of racial discrimination in public health research. So scientists often want to measure the impact that racism might have on people's health. And to do so, they need to choose first how to understand racism in the context of their study, and also how to try to measure instances of racism or perceptions of racism as well. So that's the focus of my talk. I'll give a quick introduction of the kind of approach that I'm taking, and I'm going to specifically focus on kind of operationalization and methodological choice in this particular research. So we'll look at a few different measures of racial discrimination, and one measure actually of stress, and then I'll kind of raise two potential problems that I think these kinds of methods need to address, and how values might play a role in the way that they address those problems. So really broadly, there's kind of like maybe three places that values are often talked about in scientific research. So just to situate my kind of project, there's been a lot of, especially early feminist work on the way that values can play a role in setting an agenda or the choice of frameworks for a particular research project. And there's also a lot of research about whether and to what extent inferences from evidence that we have could be or should be influenced by values. But there's been some more recent focus about this kind of middle stage of scientific research, how we actually produce the data, what kinds of data we choose to produce that can even serve as the basis of evidence for these particular inferences. And so I see my project as contributing to this kind of growing attention to this part of the scientific research process, along with scholars like Robin Bloom, Dan Hicks, Justin Biddle, and Quil Kukla. Now, in the context of studying the impact of racial discrimination on health, researchers have a lot of choices about what kinds of concepts to use and how these kinds of concepts relate to each other. So they start out just broadly interested in perhaps racism. And in fact, in this diagram, that even gets interpreted as racial discrimination. And there's a number of different aspects of racial discrimination the researchers could focus on. Some studies may focus more on the kind of environmental impacts of racism, which may include things like the kinds of choices of where to put various doctor's offices or hospitals, who has public transportation to those places, which ends up measuring something more like access, discrimination and access to healthcare. I think there could also be studies under this kind of broad framework that look more at kind of environmental pollutants, for example, and segregation in different neighborhoods. That would be another way of looking at racial discrimination. But some other studies focus much more on kind of biological stress responses instead of measuring broad kind of sociological factors about where people live. They look more at things like heart rate or cortisol levels or other kinds of physiological stress responses, and then correlate those with racial differences in the prevalence of certain health outcomes. Other studies focus much more kind of on psychology, so psychological reactions to discrimination, so people's perceptions of discrimination and also their responses to perceived cases of discrimination, and then look at perhaps mental health or physical health. So there's a lot of different ways of trying to investigate the way that racism might impact health. And so I'm going to focus on only a few in this talk, but I wanted to give you a sense of the other kinds of ways researchers might look at racial discrimination in health. So let's get to the issue of operationalization and methodology, particularly how this might be an interesting focus for values in science work. So operationalization, coming from a definition that I'm using coming from Uliana Feist's work on the topic, operationalization involves specifying a temporary and partial definition of some concept in terms of empirical indicators of the reference of that concept. Often this is going to be an operational definition will be given that may specify a particular experimental context, which may include perhaps a certain method that should be employed or a particular experimental design that will actually elicit these empirical indicators so that researchers know when to say that the referent of the concept is actually present in their particular research. So operationalization is how we kind of interpret the concepts to have empirical indicators, and then that can help restrict the range of methods that researchers might use because they need to be able to elicit the particular empirical indicators that are given. And I do think that there are some folks already talking about operationalization and its importance in research, sometimes with discussion of values as well. For example, how we operationalize the concept Hispanic will actually impact whether and in what sense we get something like a Hispanic paradox in health research. So I think that's a really interesting and important point. There's also work that Biddle and also Kukla have recognized that how we operationalize certain conditions as diseases can impact, for example, who's actually studied, who is insured. So the way that we operationalize certain populations in health research has already been recognized as an important kind of place for examining how potential values may play a role in the kind of evidence that is actually produced at the end of this research. But I want to focus more, rather than focusing on how ethnicity or certain conditions are actually operationalized, I want to look more at racism or racial discrimination rather than, for example, racial groups. So I think there are two particular problems that researchers face when they, especially when they're taking more of a psychological approach to looking at the impacts of racism on health. And for these cases, researchers may be trying to measure kind of perceptions of racial discrimination, for example. And in order to kind of actually measure the impacts of this racial discrimination, scientists first need to identify what counts as instances of racism. What are the kinds of things they're asking participants to identify when they ask them if they've experienced racial discrimination. And then the second one is to distinguish the impacts of racism from other potential oppressive forces. I mean, these researchers recognize there's a lot of different social factors that might also impact someone's health. So how do we get specifically at racism? And I think there are two kind of problems that can help show why these are difficult kind of issues in trying to figure out how to measure racial discrimination. So the first is attributional ambiguity, and this is something that psychologists and philosophers have been talking about, mostly in the context of stereotype threat or microaggressions. And attributional ambiguity is when there are certain interactions or events in which an individual might have difficulty determining whether the event occurred because of their race or some other features. These could be other social features, but they could also be non-social features. So like one of the classic examples that Donald Su gives in the microaggression research is he and his colleague are sitting on a plane. In the front of the plane, they are Black, and there are white people also sitting in the front. But when the flight attendant needs to rebalance the plane, she asks Su and his colleague to move to the back of the plane rather than any of the other people. To him, this was a case where he thought race might be involved, but as the kind of situation unfolds, he becomes less and less sure. He thinks it's very plausible race was involved, but there's no kind of smoking gun in this case that would tell him this is certainly due to my race, and it can be difficult in these kind of smaller, kind of more everyday occurrences of discrimination to sort out which ones are really due to race versus which ones may be misunderstandings. So for the person themselves experiencing this kind of discriminatory event, it can be unclear if it's actually due to their race, or maybe the stewardess is just approaching the first people she saw, or maybe she has had, she just saw their names were last on her list, or some other potential reason that would explain the situation. So researchers need to figure out a way when asking participants to report their discriminatory experiences to deal with this problem that when participants are reporting it themselves, they may not actually know whether the particular events count as discriminatory or not. And so the second problem actually deals more with intersectional experiences. So researchers are often focused more on race than they are other kind of social categories, but individuals don't just have a racial demographic, they also have many other features. They have gender identities, they have sexual orientations, and these things may actually be really relevant to the way that they experience oppression or privilege in particular cases. So when individuals are experiencing things out in the world, they're actually experiencing discrimination, there's a different kind of ambiguity that might arise, or a kind of it's a kind of intermixing of experiences where they might experience discrimination as a member of multiple social categories, that it's not clear how to distinguish their experiences based on being a member of a particular race versus being a member of a particular sexual orientation group, for example. So researchers also have to deal with this problem that experiences don't come labeled with which particular demographic categories are relevant to the case. And in fact, when we ask people about their experiences, they often think multiple categories that they're a member of are actually relevant to the situation. Okay, so let's look at some measures of racial discrimination to see how they kind of deal with these particular problems. So there are three major, there are two major measures of racial discrimination and one that I think is an interesting contrast case. So Williams had the first, the everyday discrimination scale. Krieger and colleagues developed a very similar but slightly different scale, the experiences of discrimination scale. And then more recently, there's the intersectional discrimination index. So for the everyday discrimination scale that Williams developed, you can see an example of the kinds of questions he would be asked towards the bottom of the slide. So participants are asked about discriminatory experiences that they've actually encountered, and then they're asked to attribute these experiences to particular demographic categories. So what's the main reason for these experiences? And participants are given the kind of list of common demographic categories that you might expect. Is it age or race or gender? And then they can use this to say, when participants say that the main reason was race, this can be the measure of racial discrimination that's used then to maybe correlate to other health problems among the participants to see if more perceived racial discrimination actually impacts health. Now, the experiences of discrimination scale changes this slightly, and in fact, before asking participants to, instead of asking participants to first identify a discriminatory experience and then attribute it to some social category that's the main cause, the researchers in this scale actually wanted to single out just looking at race, ethnicity, and color. And so you can see an example of the kind of question from this particular scale. They're specifically asking for discriminatory experiences that are attributable to race, ethnicity, and color. And they're asking about it in a variety of different contexts. And so this was a slight change from the Williams scale that was given before. And those are the two main scales that are used in a lot of the racial discrimination research in public health. But more recently, there was a proposed intersectional discrimination index. And instead of asking participants about race in particular, this one is trying to kind of make sense of the fact that participants may not be able to tease out for particular cases if there is a kind of main cause. Instead, they're asked, because of who you are, have you experienced this kind of discrimination, or how frequently have you experienced this kind of discrimination? And so it gives an explicit definition of the kinds of categories that we're interested in, so there's no kind of irrelevant features about who a person is, like maybe researchers here are not really interested in how much of an extrovert you are, but they are interested in these kinds of social categories, like your skin color, ancestry, nationality, but they're not asking participants to tease apart these various social identities. So these are multiple different methods that have been developed in the research, and when researchers set out to try to measure racial discrimination, they have to choose among these particular methods for a particular study, which ones they're going to use. Now, there's actually one general kind of problem with all of the methods that have been described so far. They all ask participants to first identify cases of discrimination. So they're asking about discriminatory experiences in particular contexts in a restaurant, at work, but they're asking participants for what they would consider discriminatory experiences. So all of those scales actually don't really deal well with the kinds of cases that we might see more frequently in microaggressions, where participants have a kind of ambiguity problem to decide whether or not an instance is actually a case of kind of social discrimination, or if it's a case due to something else. There's the kind of hesitancy to ascribe a particular answer to that question for a given experience. So there's going to be these kinds of borderline cases that are not going to be picked up on these kinds of discrimination scales. And so I've been trying to think about how to link this kind of choice to values. And so I've just been thinking about the kind of values that are already discussed in the literature. So drawing on Longino's work, it seems like one kind of rejection of this kind of issue could instantiate a kind of ontological homogeneity. So I'm just going to put the value out here, and then I'll try to explain a different way of measuring racial discrimination that researchers have used. So ontological homogeneity is broadly, I guess, a preference for classification into types that are maybe as general as possible. So a different way of trying to get around this attributional ambiguity problem is actually to avoid measuring kind of perceived discrimination itself, right? Let's broaden the notion. There's an issue that participants may not actually categorize certain experiences as discriminatory. So instead, let's look at perceived stress. So we're still kind of in the realm of psychology. This isn't one of the biological measures that I mentioned before. We're still asking about stressors, but we're asking about stressors, but it's the participants' perceptions of these stressors. Because we might think that some of these cases of microaggressions that are ambiguous are at least stressors, if participants may or may not be able to decide if they're discriminatory. So on this kind of view, you get it in the research looking at allostatic load, which then turns to kind of physiological cases, which would measure the kind of biological features I'd already mentioned before. But the basic idea is that what you're really actually measuring is this perceived stress with a perceived stress scale, and then you can associate this with chronic disease incidences by the different racial groups in your particular study. And the perceived stress scale, and this is just to show that this is actually used in some of this particular research. And just to give you a sense of what the perceived stress scale involves, it would be questions like these. It's asking, maybe in a certain time frame in the last month, how often have you felt that you were in control of the important things in your life? So here you might pick up the same sorts of issues that the discrimination scales are actually picking up, but you may also be picking up lots more. The benefit of this is that it's being quite inclusive. It's going to pick up all of those cases that were ambiguous for participants, whether they were cases of discrimination or not, but you may also pick up cases that may not have to do with race. We're not actually asking participants here about any of their social categories. We're instead measuring stress and then sorting by race, just by the demographic categories that they give in the particular survey. So participants don't have to attribute it to any social category, but we may also pick up types of stress that are not due to any social category at all. So why do I think that ontological homogeneity is a kind of reason someone might use this particular scale? Well, one thing I've noticed researchers who are using this scale is there's a kind of preference for identifying stress across different contexts and populations. So by using such a broad notion of stress, this would facilitate cross-group comparisons, so it makes it fairly easy when you don't have to try to measure particular types of stress that different populations might meet. But it's not going to pick up the certain kinds, or it may not necessarily distinguish between different sources of stress that arise for the participants. So it's one way of dealing with the attributional ambiguity problem, but it certainly involves a kind of value choice about preferencing stress as a kind of homogeneous category across different populations, whereas discrimination may have to be slightly specific to which populations you're actually looking at. Okay, and then let's move on to the intersectional experiences problem as the other kind of problem I've raised for researchers trying to measure racial discrimination. So it's hard to sum up intersectionality literature very quickly, but broadly, intersectionality is a kind of way of understanding and analyzing the complexity in the world, in people, and for our purposes, human experiences. So the basic idea is that the kinds of experiences that people might have in discrimination, for example, or kinds of privileged experiences may be, probably are shaped by the multiple social categories that they're a member of. So there's something it's like to be a Black educated woman that's different than what it's like to be a white non-binary less educated person, for example. So those two individuals might face discrimination in different ways that can't really be sorted out by the different categories social categories they're a part of. And so going back to Longino's kind of values that she discusses, I think that if one is taking a kind of intersectional perspective on measuring discrimination, then there are going to be two kind of values that are particularly salient for this type of project. First, you might be kind of be motivated by novelty. You want to discover and explain new phenomena that aren't really being measured by these studies that are only looking at maybe one kind of social category by itself. And then you're also probably motivated by ontological heterogeneity. You might see that there are different types of entities or events that are happening. So discrimination isn't just one kind of homogenous thing. It may occur in different ways with different features that have equal standing in our kind of the kind of science that we want to build and are also worthy of investigation themselves. So the differences here are really what's interesting and important. And I think those two are represented in some intersectionality research. And I think these values come out in two particular assumptions of intersectionality. There's a kind of epistemic assumption that the lived experiences of oppressed people are a source of knowledge about what oppression is and what form it takes. And there's a kind of ethical assumption that the perceptions of oppression do harm to members of oppressed groups and they ought to be prevented, reduced, and mitigated. If you kind of combine those two, we have a kind of epistemic and ethical kind of interaction where we want to know about these epistemic differences so that we can effectively prevent, reduce, and mitigate the kinds of harms that are produced. And I found this really interesting. It was coming out in some qualitative research about how participants actually fill out these discrimination scales. So the main two that ask you to identify either a main reason for the discriminatory experience or just ask about, for example, racial discrimination. And so when some researchers were doing qualitative work, trying to investigate how people actually respond to these questions, a lot of the participants were kind of bucking the question about which is the main reason for this discriminatory experience. So here, Trayana is saying that it's her discriminatory experiences she previously described are actually a combination of being an African American and having a degree from a well-known university, and later she also adds gender to the mix. So she thinks that really, even though the interviewer is trying to press her to identify a main reason for this discrimination, she doesn't think it fits at all. This is like a more extreme case from the interviews. There were other participants who, when forced to choose a main reason, would, but that was not the way that they were actually characterizing their experiences in the first place. So they will be kind of forced by these surveys to choose a main reason, and they will eventually do it. But that's not actually the description of the instance of discrimination and their experiences of it that they were providing. So here, I think, especially the way that the values are actually involved in the kind of choice of how we ask about the discriminatory experiences and how they relate to social identities. One is novelty. We're identifying and explaining experiences of discrimination that are inherently shaped by multiple demographic categories. So this is a kind of new phenomenon that maybe wasn't identified by these original discrimination scales. And ontological heterogeneity. It's the different marginalized groups may experience discrimination differently, which itself ought to be investigated. The differences are what's interesting in this particular case. So just to summarize, I think these different scales kind of deal with these problems differently. They satisfy some and don't satisfy others. One could choose to measure perceived stress in order to deal with the attributional ambiguity problem, but then you're not going to be measuring these kinds of intersectional experiences. You're just broadly measuring stress and then looking for differences among demographic groups. You're not asking participants to attribute the stress to anything to do with their social categories at all. So you really have no way to actually identify these kinds of intersectional experiences and how those might impact health. And the intersectional experiences problem is dealt with differently among even the discrimination scales. Clearly, the scale meant to deal with intersectional experiences is the intersectional discrimination index. And I think too, it's a little bit harder to say in the case of Williams because it partially allows intersectional experiences when you ask participants to identify discrimination, but then you ask for a main reason, and as we said before, this kind of forces some participants to fit their experiences into a box that they may not be otherwise comfortable with. So I think these are two potential problems where I think values play a role in the kind of choice of method that researchers use to measure discrimination or change the concept to stress, for example. And so hopefully this is an interesting analysis of how values can actually come to play a role in the choice of different methods and the development of different methods in this kind of research. So I wanted to end on two kind of like open questions because this is still very early days in my research. But I think two questions I'd like to address in the future are, under what conditions can we integrate evidence that's actually produced under these different value-laden operationalizations of a concept? How do we relate back the work on discrimination to work on stress? And can we integrate across these differences? And then also, I think another topic that's raised by this kind of research is whether operationalizations can kind of change the subject by defining a concept with an operational definition that's actually so far removed from the concept that our research no longer bears on the original question. So are the researchers measuring stress changing the subject from what they originally set out to study and what a lot of these researchers are actually interested in measuring? So I will just leave the open questions there because I think they're really interesting, and hopefully I will get to them soon.
Hey, thank you so much, Morgan. So we have plenty of time for questions. You can either write your question in the chat or you can raise your hand in the participant list, and I will be happy to call on you. PD Magnus, go ahead.
Thanks. It was a really interesting talk. You almost but not quite argue that the two problems can't be resolved simultaneously, that there's a tension between wanting to solve the one problem and wanting to solve the other. Is that an argument you would want to make, or do you think there's some like middle path resolution?
Yeah, thank you. Yeah, I know I've been thinking about how to frame this and whether there's actually a trade-off between the problems. Yeah, and that's probably why it comes up. I think tentatively I would want to say yes, but I haven't spent enough time looking at how researchers might actually kind of address the problem. And I think partly it might have to do with how we could integrate across results, because maybe if we have these different methods that resolve the problem differently, but we have like a way to integrate the kind of results we're getting by having certain theoretical assumptions, maybe that could help us translate between stress and, for example, discrimination. But I don't have a well worked out argument yet in that case. But I think I'm leaning towards there may be a kind of trade-off between the two problems.
Thanks.
Manuela has a related question, I think, in the chat. She asks, would it be possible to combine scales, or are they incompatible in some fundamental way?
Yeah, I think it's a really interesting question too, because it is the case that researchers often will use multiple scales, and there's a kind of assumption that they are compatible despite the differences in how they're actually measuring them. But I think it's important to recognize, especially that what we're learning from the qualitative research on how participants are actually filling out these particular scales. I think once we introduce some aspects of the scale, like for example, the ones that ask participants specifically to attribute their experiences to some particular social category they're a member of, that then there's a kind of incompatibility with the intersectional discrimination scale. So I think certain choices in the scales are going to be incompatible, but maybe some of the questions, as you could see, they're kind of similar across the two discrimination scales. So there are aspects of the scales that I think may be perfectly compatible.
Okay, thank you. Sharon Krasnow has a question.
Hi, it was a really nice talk. So I had a question about something that you might want to think about in terms of which questions these different kinds of approaches are trying to answer, because particularly when you were talking about the ontological homogeneity, I was thinking, well, you know, if you want a general response to like what kinds of stresses does racism or any kind of ism like that cause, then this is a good scale to use. But if you don't want that, you would want a different scale. And I think that also relates to the question about whether or not you can integrate the scales. So maybe focusing on what questions are being addressed with the research might be useful.
Yeah, thank you. And I think that also relates to something like another feature I wanted to try to look at. It would be interesting to think more carefully about exactly how researchers, what questions they're actually investigating. Often they all will kind of frame their research as broadly looking into racism in health, but perhaps we should be more careful about distinguishing different kinds of questions. Because one kind of observation I've had in looking at some of this research, especially because I'm more familiar with psychological methods, so I started there, is that a lot of the psychologists will end up just honing in on either these experiences of discrimination or also coping methods as a kind of moderator for the health effects. So if some coping methods are more effective than others at preventing kind of bad health outcomes, what are they? But by narrowing the focus from the kind of broad diagram of all the possible kind of ways of thinking about racial discrimination and how it might be impacting health, these psychologists are in effect kind of suggesting certain kinds of interventions that are focused on the psychological level, rather than considering other kinds of interventions that may be appropriate. If we learn that a certain coping method is more effective, it seems very tempting that these researchers might then go out and say, well, how should we deal with this problem? Well, we should, people who experience racial discrimination should adopt this coping method, which puts a lot of stress on the people who are experiencing these things, rather than thinking about how could we reorganize society in certain way, or our city in certain ways. So that's just a kind of side observation as well, that I think might be similarly related, to get more clear about how these kinds of questions, versus how the researchers explain what they're doing versus what kinds of questions they're actually addressing.
Okay, Katie has a question in the chat. Have you talked with any researchers involved in doing this work and shared the problems you've identified? If so, how did they react? If not, are you planning to disseminate this?
Yeah, I think that's a really interesting, that's really cool. And it hadn't occurred to me yet because I'm quite early in the research. So I haven't actually talked to anyone. But I think that would be a really important way of kind of talking to researchers that might actually show philosophers can help them, or kind of think about what the problems are and the kind of choices that they're making. So that's something I would be very interested to do in the future. Thank you.
Kristen Intiman has her hand up.
Hi, Morgan. Thanks so much for your talk. I think my question is a little bit perhaps of a follow-up to the question Sharon Krasnow was asking. I think you did a really great job of showing, I think this is a great case of how both intertwined ethical and epistemological values are relevant to certain methodological choices. But one thing I found myself wondering about throughout the talk is, the problem of attributional ambiguity and whether this is really a problem in this sense. So, it seems to kind of be setting the bar high for, how we might think about, health disparities that result from racial discrimination, sort of like with smoking, putting the burden on showing that a particular case of lung cancer was the result of smoking as a result of something else, instead of thinking about it kind of at the population level, where it's just, in fact, smoking does raise your risk of lung cancer. And so I'm, perhaps my question is just, is this really a problem? Does it depend on kind of what we want to do with this research or the research question being asked? I mean, I can see how it could be helpful in some ways, but maybe, it's like there might, and again, values might be relevant to this judgment, but thinking about, is that really how we want to even think about, racial health disparities or that disparities that result from discrimination?
Yeah, thank you. That's really helpful. Yeah, so in a way, it might be that researchers recognize that there is an attributional ambiguity problem, but decide that it's not that much of a problem, depending on what their interests are, or if they find looking at if again the kind of value that I said for the stress research, they may be just more interested in comparing broadly across different populations rather than the specifics experiences of a particular population. Yeah, so I think that would be an important thing I should do next, is look at exactly what the researchers are using this research for, and which projects would it matter that attributional ambiguity is a problem. So I think certainly for cases, if what we're interested in is racism, not the kind of overt kind of racism, but something more like microaggressions, and we want to measure the effects of microaggressions there, I think it is crucial, but perhaps less so to other sorts of projects. Thank you.
Okay, Laura Couples in the chat asks if there's a corresponding paper that you could share, because she's teaching a course on measurement, history and philosophy of measurement in the spring. So maybe if there is something, you could share it in the chat at some point.
Yeah, I don't have a paper yet, but there may be maybe one of Sean Baez's papers. I think he has a recent chapter about how the census measures Hispanic populations, and how having one question for race and ethnicity or two questions actually impacts how people respond and who actually counts as Hispanic. So perhaps that's relevant. Yeah.
Paul Franco has a question.
Yeah, thanks. So this might follow up on Kristen's question, coming at it from a slightly different direction. So I wonder if you could say a little more about how intersectional identity is understood as this sort of causal force in the literature, because I'm thinking about what Nancy Cartwright says about the composition of causes, right? And we might think there isn't, for example, separate forces of like sexist discrimination, racist discrimination, gender discrimination, all sort of competing, like the way the interviewer kind of thinks about it, right? Okay, you gotta attribute it to one force, right? Instead, we just have the resultant experiences. And perhaps once we just have the resultant experiences, instead of figuring out how to attribute it, maybe we just go to stress or something like that. So um, are these intersectional identities understood to be sort of like additive in some way in the literature? Or yeah, so that's it. Thanks.
Yeah, I think I would want to look more at ways that researchers might look at intersectionality generally. But I think for the case that for the kind of reasons that motivate the intersectional discrimination index itself, they are interested in these actual experiences that are not at least perceived by the person themselves to be due to multiple different features of their social identity, where I think the way that they would describe them is not, you can't just say, well, isn't this just, when the example that I gave, Trayvana, I think she, if you told her maybe, well, isn't this just because of your education? And she won't accept that answer, because for her, it actually really is also about being a Black educated woman and what comes along with that, which probably is very different from the experiences of being a Black educated man or a white educated woman, for example. So I think the experiences themselves are not kind of additive in this particular case. But I do think that there are some instances of ways of looking at intersectionality that aren't supposed to be as additive, but sometimes may amount to that. So the cases, I could imagine, for example, like the stress researchers, they might want to do a kind of intersectionality analysis in their data to look to see maybe how like race and gender work together in their, if there's kind of a additive or compounding, like multiplicative effect in their data set. And there you're really just, instead of asking about people's experiences, you're just using the kind of categories they assign to themselves, and not asking if those stress experiences are at all related in their opinion. You're just looking at overall stress and how that differs between groups. So I think there are multiple ways researchers look at intersectionality, particularly because it's such a complex kind of theory and there's different lines you can kind of focus on in it. But I think for this case, the researchers are really interested in experiences of discrimination, which is, I guess I didn't really mention that either, but the kind of focus on experiences is interesting because it gets around certain problems of measurement as well. You don't have to figure out how to show that there really is a case of discrimination. That's just not really relevant. Even the perception of itself psychologically is important for the kind of mental health and well-being or coping strategies, for instance. So that's a kind of general approach of the research, is just to focus it on experiences.
Okay. Kevin has a question in the chat. I think it's also relevant to what you were just saying. Do you know if there have been efforts to talk with various populations about their preferences or concerns, or suggestions for how to ask them about their experiences more effectively?
Yeah, I'm not sure if there have been, but this is something I would be really interested to see. And it might help clarify the kinds of questions about the kind of focus on what the kind of questions that are driving the research, and so then which methods and concepts are appropriate. I think that this is like the kind of ethical part of looking at the kind of changing the subject issue that I'm interested in looking at in the future. So for example, if we have like certain communities that have a question that they would like answered, and scientists get involved trying to answer that question, but in the context of doing their research to make the concepts fit better with the kind of methodological commitments in that field, or just the measures that are already available to them, they modify what the question is and the concepts in that question. Then they're not actually answering the question that the kind of the community or the public group was actually asking for evidence about in the first place. And so I think in cases of policy relevant science, this could be a potential big issue of in that shows up particularly in operationalizing particular concepts. I don't know if anyone has done that, but I would be really interested to see if people have. And as I continue to work on the project, hopefully get more, learn German a little better maybe, or maybe find other communities to work with to see what kind of groups want this kind of research and how they view the different choices in operationalizing the concept. I think that's a really important part of the picture.
I think we can squeeze in one more question from John Rosenberg.
Hi, thanks so much. I found this really interesting and speaks to a lot of the stuff I've researched as well. And so I guess to follow up on this same kind of thread, I'm curious if you've thought about the sort of relationship between attributional ambiguity and in some ways the like inherently contested question of whether or not something like a microaggression is racist, because it seems like within the sort of, I mean, we're kind of working that out at the moment. And to sort of thread back to, I think, the points you were just making, and Kevin and Paul and Kristen's points, for some folks, the ambiguity may be a kind of virtue in that it leaves room for that political commitment to the contested nature of these actions. And so I'm curious just if you have any sort of thoughts about that. It's just something,
Yeah, I think that like Regina Rini's work that kind of includes the attributional ambiguity as a way of defining microaggressions is a really interesting and compelling point. I actually really like it. And yeah, I think especially this is interesting. I didn't talk about this work here, but I'm also interested in the way that researchers are talking about implicit attitudes. And there, I think comparing psychologists, attention to implicit attitudes versus attention to microaggressions is a really interesting case that, one gets so much more attention and the other kind of doesn't receive nearly as much funding or kind of emphasis in the public as well. And I think that the kind of arguments that researchers working on microaggressions focusing on accounts like Rini's, it give really good arguments about why there should be much more investment in the microaggression research, that we don't have to end up having these discussions about whether implicit attitude measures are actually measuring something implicit, whether we should be responsible for these attitudes. It focuses so much on the kind of side of the person doing the kind of interpersonal racist action instead of actually focusing on the harms. And so I think those are really persuasive arguments, and why yeah. So yeah, that's an interesting point, though. I should think more about what researchers might do if we do think that this is a beneficial part of talking about microaggressions in particular. How would they approach the different measures? That's a really helpful question. Thank you.
Okay, thank you so much, Morgan. Really appreciate the talk. Good discussion. And we now will have a 10-minute break. We'll start back up 5 minutes after the hour. So see you then.